Anti-aging facials. So we all age. The main cause behind aging is an expiration of telomeres on our genetic code, which means basically that we stop renewing the cells in our body because we just run out of them, and eventually it just gets static, and we have what we have. And even though there's a breakdown and wearing of whatever cells that we have, whether we're talking about like muscular cells or facial cells or whatever, that's what we're stuck with for the rest of our lives. And it usually starts around the mid to late 20s to early 30s, right? People are different genetically. Some people are blessed. However, we can choose to improve how we age, and how we do that is by retaining cell wellness for what we have, and also encouraging artificial cell turnover. If our body isn't willing to do it itself, we can sort of encourage it to do it through safe non-invasive chemical means. So the first thing we do is we do an intake, because we want to figure out whether your skin is looking a little bit dehydrated, or is missing some moisture, or whatever it is missing. We want to be able to tailor and give it what it needs to retain a youthful appearance. And we also want to be able to encourage its own resurfacing without irritation, and the healing of the skin barrier, because that's just going to make you look amazing non-invasively for way longer. Non-invasive temporary lift facials are medical massage facials. It combines lymphatic drainage to promote circulation, to reduce puffiness, to reduce sinus liquid, swelling around the eyes, and it also lifts the musculature, perfusing it with blood flow, and lifts the skin, because at the end of the day what we're fighting is gravity. So we're basically not only perfusing your face with the nutrition that might be restricted in certain areas, but we're also aiding and encouraging neurological connection to the miniature muscles in your face, and also we're sort of training them to, over the long run, retain their original buoyancy and resist the drag of gravity. It is non-invasive, it is way cheaper, and it's for people who like are pretty happy with how they're aging but just want to retain non-invasively on a daily basis. Honestly, it's amazing, and it feels great. I practice it myself. I can't even rave about it enough. Acne-based facials. If you have issues with acne, the reason isn't always a single reason. Acne can be hormonal. Acne can just be a skin type, or it can be based on an issue you're having, like excessive dehydration or overusing products, for example. So we do an intake, a skincare intake, to define exactly why you're having an acne issue, and then the treatments that we then apply work regularly to decrease your skin's tendency to secrete excessive oil as a response to whatever is happening. So we don't just treat the symptom, we address the cause if we're able to as well. Now, there are certain things that I, as a esthetician, cannot address. So for example, I can't balance your hormones for you. That would be something that you talk to a doctor about, a dermatologist about. However, I can help you with, for example, PCOS-based acne. I address the skin, I address the acne. The hormonal side of things you will need a doctor to address, for example. Now, with acne treatments, I generally recommend a once a month for 8 sessions. And usually at that point, if you are also maintaining the routine that we decide on at home, usually we can see some real significant improvement, especially when using some of the really amazing high technology that we have nowadays. You can really change the skin's tendency to over-secrete oils that are allowing bacteria to feed on these abscesses that are happening in your skin. What do I specifically mean by neuroactivation, and why is that something that is offered at Sekhmet Wellness? Sometimes when your muscles are so tight and restricted for a very long time, you are not aware that you have lost sensation or activation in a certain area. Your body is brilliant in that it is built to compensate, even when something isn't working properly. So some people go through life and they literally have not noticed that they are missing proper movement in an area till something else starts to hurt. And then when we get into trying to heal the thing that is hurting, we realize that it's actually overactive and is injuring itself because something else has lost sensation. When I say we work on your neuroactivation, what I mean is we look at movement dysfunction, postural dysfunction, and we try to correct it if we can, because all bodies are different. If it ain't broke, don't fix it, right? If something is not neurologically active, if you're not feeling an area, if you've lost sensation in an area, if there's something that we need to neurologically train your brain to readjust to eliminate pain in your body, we absolutely can do that at Sekhmet Wellness. In fact, we love doing it. We're nerds for it. So, Sekhmet Wellness scalp treatments. We do science-based scalp treatments. That is 30 minutes of increasing blood flow to your scalp. We use rosemary oil, which is scientifically proven to increase hair thickness, hair health, and also to reverse grays in some research. It is shown. Nothing is guaranteed. We are not magic. If you have serious alopecia concerns, please talk to a dermatologist. But we definitely can provide hair health from water-based masks for dehydrated and damaged hair to oil treatment. Not just rosemary oil on scalp, but for the hair itself, we use a mixture of olive, coconut, and castor oil, which is a little North African secret from my people that basically creates a shiny, supple hair growth, healthier hair growth. TMJD, temporomandibular jaw dysfunction, is when people have several symptoms that indicate that they're having jaw or face issues. Some people have repetitive chronic headaches. Some people have migraine issues. These can be caused by whiplash, concussions, night gritting or grinding of the teeth, and yes, those two things are very different. Even excessive muscular tension in the posterior neck can cause anterior or front facial discomfort, jaw discomfort, misalignment in the muscles of the face because you're being pulled from the back. So of course everything in the front is going to react negatively and harden up, right? To try to balance out the pressure from the back of your neck and the back of your head. So temporomandibular treatments, at least the way I do them, always treat the back of the neck, the scalp, the whole head, and also sometimes the back and the hips. It really does depend what is causing the grinding, the jaw pain, the lack of sinus drainage. There are many reasons why people are experiencing TMJD, and we have to figure out what that is first, which is why there's always a mandatory intake for the first appointment. We don't just go in there and do an intraoral right off the bat. First, we have to start with whatever's happening on the outside. We have to make sure we know exactly where we're going in. We have to take a health history to make sure that if you've had dental surgery or anything like that, we're not gonna hurt you further and mess up based on knowledge that we don't have. And also let us remember that there are 3 major facial nerves that we are trying not to aggravate. So, yeah, that's why the intake is mandatory, and that's basically a blurb about TMJD. Hot stone. Ugh! I love hot stone massage. Hot stone massage is perfect for people who are having circulation issues and lymphatic issues, even though it's not lymphatic drainage massage. The warmth and how we respond to heat, and moist heat specifically as a human creature, it expands our capillaries. It's like if you had a cup of coffee and you stirred it, and then you took the spoon out and you started to see that it still swirls for a bit, right? So hot stone is really great for tight muscles, tight musculature, the cold, prolonged chronic illness. It can really sort of jumpstart your circulation and your immune system. I can't say enough good things about hot stone, and it feels incredible. Like, it's also like amazing, just sensation wise. It helps with sleep, it helps with anxiety and depression. Of course, we're all different, so we never guarantee results, but if you feel a little under the weather, if you feel exhausted, tired, if you feel like your sleep is not what it should be and that you have really tight muscles, hot stone massage is the massage for you. It not only addresses aches and pains, but it sort of works to keep the effect going for a while afterward through blood flow, essentially. Cupping. Cupping. Cupping is an aggressive treatment. It is historically out of the East. So, for example, deep tissue massage is often called Swedish massage because it originated in Sweden. Cupping originated, I believe, in China. It is a very Eastern practice that nevertheless is very effective in science-based clinics and sports therapy, because if you think of a massage as a practitioner pushing down on a restriction that isn't healing within your tissues, cupping sucks up enough and causes enough selective damage within the locked tissue with no circulation in it that it pops a few capillaries, so you get some bruising. So be prepared to see, like, it looks like you had a fight with an octopus, right? Be prepared to see a suction-shaped bruise. It shouldn't be extreme. It should heal within a couple of days and not be painful to the touch. What cupping does is, through pressure, it forces your blood and your immune system, your lymphatic system, into an area that's locked down by breaking a few capillaries, so that your immune system finally addresses this chronically locked down area and resolves the issue that is keeping your tissues from functioning normally. So it's like selective damage, right? So where you have, for example, a hose that's kinked, cupping essentially is like high pressure water that forces its way through that kinked hose, straightening it, right? If you think about it that way. Does it leave bruising? Yes, be prepared for bruising. It should not be extreme. You shouldn't have a blister. It shouldn't look like you had a burn, right? But what we do want is like a nice, healthy purple color that your body has to then address that area, and we use your own immune system to sort of resolve it. So a massage therapist pushes and cupping sucks up, okay? Rehab training and neural activation. Why am I, as a massage therapist, offering that at Sekhmet Wellness? The truth is, as a registered massage therapist, that is a continuation of my work. So most massage therapists should be qualified to offer stuff you can do at home to help you not constantly come in and spend money on the same issue again and again and again. These are non-invasive treatments treatments. What I do is non-invasive, i.e. it's not surgery. I don't cut into your body. I don't enter your body in any way. That's actually really against the rules for us. So we can backslide really easily, and the effect can be limited to what your body allows us to do. So rehabbing, giving you exercises, stretches, and working on the proper activation in your musculature is a way of guaranteeing that we are actually going to make complete progress on the area we're working in. Because I could deep tissue an area that you've injured for the rest of your life. If you are not rehabbing it at home, then I must confess that we're only doing 50% of what is necessary to stop that same injury reoccurring, and keeping you within the same loop of treatment. Deep tissue massage. Deep tissue massage is different than relaxation massage. Both are extremely beneficial to the human body, but people who are generally looking for deep tissue are looking for something to resolve a chronic pain issue or a chronic numbness or lack of sensation issue. So deep tissue can be more aggressive. It is more focused, even though it accesses neurological relaxation because it eases pain. It is more focused on resolving scar tissue, resolving chronic pain, chronic illness in a certain area, whether it be joints or musculature or tendons, etc., etc. I use my elbows a lot. We work within the patient's tolerance, but there has to be clear communication between the patient and practitioner. I always tell people it should not feel like you are getting hurt. You should not be clenching, or else we're doing the opposite of what we came in to do, right? So I always say if 6 is a challenging but yummy sensation, then we should not exceed a 6 out of 10. If you're someone that really requires like a really deep pressure, I always say that we should not exceed a 7 out of 10 maximum. Okay? Look at this line. Absolutely stunning.